Hello students, so we are beginning with the new chapter, that is the evaluation and management, and this topic is slightly different because what we are coding here are mainly the cognitive services, not the procedures. So the most of the code which we have seen in the previous few sections, they were the procedural code, but here these are the cognitive services where the physician or the other qualified healthcare professional diagnose and treat the illnesses or the injury, and we code that particular visit. So whenever we are coding that particular visit, the guidelines and then the that we follow in this section are very different. So let's begin the section and let's try and understand how to code for this section. So first of all, you must understand where this ENM services are given, because they are given in the various setting, and this various setting include the office or the outpatient visit. And that means when the patient seek care in the clinic, physician office or outpatient facilities. Then the hospital observation service, where the patient is under observation. He could be in the hospital setting or he may be in the observations setting, but he is not admitted into the hospital. So this is very important. Then the hospital inpatient service for the patient admitted to the hospital. So here the patient has been admitted to the hospital. Then the consultation, when one physician seeks advice from another professional qualified doctor. Then emergency department service is for the urgent medical situation. Then the nursing facility service, it is a care provided in the nursing home. Domiciliary care service, which is a home based care. And home services, where the medical doctor visit and conduct the visit at the patient's residence. So these are the various setting where we can apply the ENM service. Now, next important is, as far as the EMN is concerned, we have to consider the three important factor. What is the type of the service, what is the patient status, and what is the place of the service, because these are the very important criteria: the type, status of the patient, and the place of the service. So let us understand in detail what do you mean by the type of the service. The type of the service could be evaluation and management, it could be consultation, it could be critical care, or it could be preventive medicine. Then where the service is given, that decides the place of the service. Whether have you given the service in the hospital, whether it is a office or the outpatient, whether it is an emergency department or whether it is a nursing home. And what is the patient status? Is he a new patient? Is he an established patient? Is he an inpatient or is he a outpatient? So let us take one example where we can see the kind of service, status, and place of service. A new patient present to the office of the psychiatrist in the town where she has just moved. She had been under the treatment for the depression where she lived previously, and her new psychiatrist performed a medication history, side effect history, and mental status examination. He then prescribed an antidepressant to the patient. So what is the service? It is evaluation and management. Status of the patient, it's a new patient. And where the service, place of service is office. So we can derive all this information from the given documentation, and this information is very important for you to zero down the code. So let us understand the various patient status. Here we are first of all finding out what do you mean by outpatient and inpatient. Outpatient is the this concept applies to the patient who receives the medical treatment but are not officially admitted to the hospital. This is very important. It is typically involves a single visit lasting few hours or with a duration of 24 hours or less, and mainly include the patient treated in the emergency room or the practice, that is office, or the patient who's under observation status. While the inpatient is the inpatient coding applies to the patient who has been officially admitted to the hospital under the physician's order. The inpatient remains classified as such until 1 day before the discharge. An example is the acute and long-term care hospitals, skilled nursing facilities, hospice, and home health services. So this is classification status is very important. So now the next concept is new patient. A patient who has not received any professional service from the physician, qualified healthcare professional, or another provider in the same specialty and group within the past 3 years. So the patient who has not received the service within the past 3 years, but the specialty also has to be same and the group also has to be the same and established. So the specialties cardiology, dermatology and oncology. These are the specialty. Group is in the Indian context, Apollo group, Fortis group. These are the two different chain of the hospitals. And establishes who has received the professional service within the past 3 years. And this is the definition that is there in your book. So depending upon the patient status, these are the code which we use it for the outpatient services. So you know by now what is outpatient services. In that office or other outpatient services, other outpatient means the observation status or ED. So in that you have the new patient code which are 99202 to 99205 and established patient code which are 99211 to 99215. So I would highly recommend to open the book and see these codes. Now, let us understand what the E&M service mainly consists of. So, it mainly consists of the history, exam, and medical decision making. So, what is history? Is gathering the information about the patient's medical background, symptoms, and relevant details. Then the examination is physically assessing the patient to identify the signs and symptoms. And this is very important, that is a medical decision making. It is determining the appropriate course of action based on the patient's condition. Now, to code the E&M service, we have to check only the medical decision making and the time. The medical decision making includes the history and examination, because whenever you are taking the decision, you are going to go through the history and exam. So we are going to pay attention to the MDM, and that is the medical decision making, and how much time is required for that visit, because every visit has a time cap. So let's see. Now these are the various charts that you will see at the beginning of the section, and you will see office or the other outpatient services, and then the codes are written here. Here it is medically appropriate history and examination. Since it's a part of the MDM, we do not now have the different level, but what we look for is the medical decision making, and in this case we have the different level: straightforward, low, moderate and high. Straightforward is the level 1, low is the level 2, moderate is the level 3, and high is the level 4 type of examination. And every this examination has the time limit. Whenever the MDM is straightforward, it will take only 15 minutes. And whenever it is a 30, sorry, it is a low, it is 30 minutes. Whenever it is a moderate, it is 45 minutes. And whenever it is a high, it is a 60 minutes. And this is for the outpatient, and this is also for the outpatient. But then why we have the two different table? So this is for the new patient and this is for the established patient. So remember, in the new patient we have only 4 codes, and for the established patient we have these 5 codes. Okay, and every code has a medical decision making level and then the time. Okay, so this is very important. Now let us take some example where how can we zero down the code. So patient arrives to the physician office for a follow-up hypertension treatment. The physician carried out the medical appropriate exam with low MDM. Now many a time what happens is they give either the medical decision making level or they give the time. Now in this case, I know the medical decision making is low. So now I will have my chunk. That is, Is the history and exam has been done? Yes. Where is the location of the visit? It is in the office. Is it a new patient or established patient? Now many a time they do not write the word established, but you have to derive that information. How can I say it's an established patient? Because this is a follow-up visit. That means he must have come last week or last month. And what is the established patient means? The doctor has seen the patient or the patient has seen that doctor in the last 3 years. So this is an established patient. And medical decision making is low. Now I have this data. Now what I will do is I will go and see my codes. So I'll pick up this table. In that table, I will check what was the medical decision making low. So I'll pick up the code 99213 and this is the table for the established patient. So far so good and it is easy. Now let us take one more question. Roger arrives to the physician office for the follow-up of hypertension treatment. Dr. Ross carried out a medically appropriate exam and spent 30 minutes with the patient. So whenever they are giving any particular case, either they will give the level of the MDM or they will give the time. Now in the previous example, they gave us the level of the MDM, but the time wasn't given. But now in this exam, the time was, in this particular example, the time is given, but the MDM is not given. But doesn't matter because we have a chart and in that chart, we have the MDM level or even the time. Now here the time is 30 minutes. Where I can see the time 30 minutes, it is in 99214. So I'm going to pick up the code 99214. And remember, whenever you are coding for the time, it has to match this time or it has to exceed. If it is lesser than 30 minutes, I cannot pick up the code 99214. Then I'll have to settle for the lower range code, that is 99213. So it has to match or exceed. Now I want you to have a complete attention because we are going to go slightly into detail of this new and established patient concept. Now we know that if the patient has not taken any medical service in the last 3 years, he becomes a new patient. And if he has taken the service within the last 3 years, he becomes an established patient. Yes and no. No means new patient. Yes means he is an established patient. But in the established patient, the second question we ask, exact same specialty. Like, for example, the cardiology, oncology, nephrology, and dermatology, these are the various specialty. So, if he has taken the service from the same specialty, then he becomes an established patient. Okay, like last year he has taken from oncology, this year also he has taken from oncology. So for the oncology department he is an established patient because he has taken the service within the 3 years gap and from the same department. But suppose if last year he has taken the service from the cardiology and this year he is taking a service from the oncology, then for the oncology he becomes a new patient. Okay, this is very important. Now let's assume that last year also he was from the oncology, this year also he is taking from the oncology. Let's say he is a cancer patient. So yes, then he was an established patient. But now we are going into the deeper exact same subspecialty. Now what is that? So for that I want you to understand. Let's say Dr. A and B, there are two doctors who are working in the oncology department. Okay, so the Dr. A is an oncologist. Basically, he is a cancer specialist. But Dr. B is done the super specialization. What is that? He is treating only the nervous tissue cancer. That is he is a neuro-oncologist. So this is a super specialization. Now let us come here. So exact same specialty, subspecialty. Yes, then he is an established patient. No. So let's assume a case of a patient who has got a cancer, and last year he had a bone cancer for which he had gone to Dr. A. But now this year, because the cancer has spread everywhere, it has reached to his nervous tissue, for which he has to go to the Dr. B, because Dr. A only treats the cancer in general, but now it has gone into the nervous tissue. So Dr. A says you will have to go to the Dr. B. Now, if he stick to Dr. A, he becomes an established patient. But he has gone to Dr. B. For Dr. B, he has never seen that patient first. or he has never seen that patient earlier. So for Dr. B, he becomes a new patient. Okay, so this is a very, very important concept. Again, I would suggest that you go back and listen to this concept and get your, understanding very clear. Now, one must pay attention to these different keywords that they use it for the new or the established patient. Like if it is a new patient, they will use the word initial visit to the physician or doctor is seen the patient first time, or doctor or physician seen the patient earlier, but that visit was 3 years prior or before 3 years. Then he becomes a new patient. Patient is coming for the second opinion, he is a new patient. Dr. X is seen the patient earlier, now the patient is coming to Dr. Y, not of the same specialty as of Dr. X. So the patient will be new patient. I gave you the example of the cardiology and oncology. Okay, so Dr. X has seen the patient earlier maybe with 1 year back. Okay, but now the doctor is Dr. Y and he is from oncology. So then also it's a new patient. Now what are the keywords for the established patient? Directly given the patient is established, which is very rarely given. Usually they will use all this keyword. Patient is seen by the doctor twice or more than that within the 3 years interval. Patient is seen by the Dr. X, but now within 3 years of the time, Dr. Y is seeing the patient, but Dr. Y is of the same specialty or subspecialty. Then the patient is said to be established. And patient is seen by doctor, primary care physician, but within the 3 years of the time. So these are the various keywords they will use it. Try and understand them very carefully so that it will help you to master the concept of the new and established patient. So let us take few example whether we have understood our concept well. So this is the example, a 37-year-old female patient with a history of dyslipidemia and chronic pain arrives to her primary care physician's office. PCP stands for primary care physician office for follow-up of her lower extremity swelling. The patient indicates that the swelling responded to hydrochlorothiazide. Limited exam was carried out and her labs and echocardiograms were reviewed. The patient does have moderate pulmonary hypertension. Final diagnosis assessment, bilateral lower extremity swelling, improved with diuretics. This may be secondary to pulmonary hypertension. Etiology is not clear at this time. We'll do a workup and possible referral to pulmonologist. Plan, I think we will need to evaluate the etiology of the pulmonary hypertension. The patient will be scheduled for sleep study. Time, total time of encounter is 30 minutes. Now let us drill down. Okay, the history and exam, yes, they have carried out the history, they have taken the limited exam, has been done, history has been done. Where is the location? The location is the office. Okay, then is he a new or established patient? Established. How do I come to know? That is follow up of the lower extremity swelling. Then what is the total time of the visit? Total time of the visit is 30 minutes. And medical decision making, we have to see. Now the MDM they haven't given, but they have given the time. Either we use the MDM or we use the time in order to fix our code. So it is a established patient. The workup is 30 minutes and we will go and see our code. So this is the chart of the established patient and how much it is the time? The time is 30 minutes. So our code will be 99214. Okay, this is as simple as that because I took the time which was there, given by the doctor. Now the next example, a 14-year-old female patient with a history of cystic acne arrives to her dermatology oncology initial visit for the treatment. She was referred by her general dermatologist who belonged to the same practice. The provider carried out the comprehensive history exam and reviewed the patient chart which contained a comprehensive metabolic renal and thyroid panel with the skin biopsy. Final diagnostic statement, chronic cystic acne. Total time of encounter is 60 minutes. Now, first of all, check, we will find out. History and exam, yes, carried out. Location of the visit, it is the office, okay? And then the type of the visit, new or established. Now, we need to find out whether it's a new or established. Okay, she was referred by her general dermatologist, where she has come to her dermatology oncology. Okay, so this is a super specialty. Dermatologist referred by the dermatologist. So we need to find out what is a whether she is a new or established patient. Total time is 60 minutes. Okay, so we know this is we don't know what is the status of the patient, but we know that the total time is 60 minutes. So let's see what's the answer. So the patient was an established patient to the dermatology, but she is the new patient for the dermatology oncology. And if you remember, exact same specialty, subspecialty, yes and no. The subspecialty is different because the specialty is dermatology and subspecialty is dermatology oncology. And then she becomes a new patient because she has not. And we have one more clue here, that she was referred by her general dermatologist and initial visit. So that is also enough for you to understand, but do not jump into that. Always use this tree in order to find out. So now what is the information? She is a new patient, and then new patient, and the time is 60 minutes. So if I put that data, I will know what's the answer, and the answer is 99205. Kindly check the table for that. Now let's go to our chart. So in the chart, I will check the code. And if you see the last answer, that is 99215, the code is 40. Okay. And if you see, this is the code language. Office or other outpatient visit for the evaluation and management of an established patient which require a medically appropriate history and or examination and high level of medical decision making. When using the time for the code selection, 40 to 54 minutes of the total is spent on the date of the encounter. So what is it? Total time is 40 to 54 minutes. 55 minutes or more, see the prolonged service time, that is 99417. This is a note which is written below 99215. What is our time? It is 55 minutes. So this is 40 or 54 minutes is the time, but our time is 55 minutes. Then I will have to take the help of prolonged service time. And this is the table of the code, that is 99215, prolonged service time 99417. Total time to report initial unit of the prolonged service is 55 minutes. And that's why we will write the code 99215 and 99417. Pay attention that this is the add-on code. So this code will come in the second place. The first code has to be 99215. There are many parenthetical notes which are written here. They are very, very important. Pay attention to that. Do not report 99417 for any time unit less than 15 minutes. This is a very important, very important instruction. So I will write the answer 99215 and 99417 because that will be an additional time that I have taken for this patient, and that I will have to mention like this. So let us take some example. A 80-year-old patient is returning to the gynecologist office for pessary cleaning. Patient has no complaint. The nurse removed and cleaned the pessary. Vagina is swabbed and with betadine and pessary is replaced. She was asked to follow up in the month time. What are the CPT and ICD codes which are reported for this service? Now, if you see that she has come to the office, so that is one important tip. And who carried out the service? It was carried out by the nurse, and the physician wasn't present, and there is only one code which is for the services of the nurse and not a doctor, and that is 99211. So we will see that code 99211, and we'll see the ICD code. So let us see what's our answer. So yes, B is the answer because that is the only service which is carried out by the, these are the non-physician services carried out by the nurses. 55-year-old female present to the physician office complaining of the persistent abdominal pain. The patient is new to this practice, and the physician took a medical decision making, and it is of moderate complexity. The physician spent approximately 50 minutes with the patient. The physician spent 15 of those minutes counseling the patient on dietary changes. What code correctly captures the encounter? So let us pick up our data. It is the physician's office where the visit has happened, and it is a new patient, and the MDM is of moderate complexity, and we have a MDM also and the time also, and then the time spent is 50 minutes, and in that 50 minutes the 15 minutes was for the counseling. So we have enough data. So let us see what our answer is. Yeah, so the correct answer will be 99204, because if you see, it is a moderate complexity, the new patient, and then the time limit is 45 minutes. So it should either meet or that particular time, and that's why we have chosen the code 204. 214 and 215 is an established patient, and 205, it talks about the 60-minute and higher complexity, so we cannot take that code. So 204 is the right answer. Chief complaint: writing vinyl hernia. A 40-year-old Stephen, athletic man, has been aware of the bulge and the pain in his right groin for over a year. He is very active, both aerobically and anaerobically. He has a weight routine which he has modified because of this bulge in his right groin. Usually he can complete his entire workout. He can swim and work without problem. Several weeks ago in the shower, he noticed that there was a bulge in the groin, and he was able to push on it and make it to go away. He has never had a groin operation on either side. The pain is minimal, but it is uncomfortable. It limits his ability to participate in his physical activity routine. Dr. Jacob told him that it would be dangerous to have this because it will turn into incarcerated hernia. Dr. Jacob discussed observation and repair and documented MDM of the low complexity. He is motivated towards the repair and described the operation in detail. Dr. Jacob gave him the scheduling number, and Stephen will call and arrange the operation. Now we have the code, all the code, if you see, they are for the new patient. So this is a new patient. The meeting happened in the office, and what is the MDM? MDM is low. So if you take all these things and see the table, you will realize what is the correct code. So just check the table here, and if you see the table, check this particular code, and the time is not given, but MDM is given, and that is enough for us to zero down our. So yes, 99203 is the answer because we have the low MDM that is with us, and the code corresponds to 99203. So though the time is not given, we can very well zero down our code. How does the CPT professional edition define a new patient? And we know the criteria that a new patient is the one who has not received any professional service from the physician or another physician of the same specialty who belong to the same group of the practice within the last 3 years. So that is the definition. So you have heard the definition right now. So kindly apply that definition and pick up the correct answer. So yes, answer B is the correct answer. And here we finish our part 1 of the ENM, and now we'll begin with the part 2, where I'll be talking that when the time and MDM level is not given, how to get the MDM level from the data that has been provided to us. So that will be part 2.